I had the great pleasure to have two research presented at the WCLC, one as first and one as last author. The research as the last author is about a very rare condition in a very rare malignancies, because this abstract and this presentation is focused on the very rare syndrome which is detected in thymic tumors, called Good syndrome. Good syndrome is defined as a severe immunodeficiency with gamma globulinemia and a higher infectious disease detected in this very rare oncological population. And since our center is a referral center in Italy for patients with immunological dysregulation and thymic malignancies, we have had the pleasure of deepening the immunological dysregulation, taking into account the coexistence of autoimmunity and immunodeficiency. And what we have seen in our research is that patients with both Good syndrome and autoimmunity disease have a higher level of white blood cell, but have a very low level of Treg lymphocytes and of CD19 B-cell lymphocytes. And as the result of this important immunological dysregulation is that these patients are very, the immunosuppressive therapy as well as the systemic chemotherapy, or as well as the immunotherapy with immunocheckpoint inhibitors may be very dangerous in these patients with this baseline immunological dysregulation. So we hope that all the physicians who care about patients with the thymic malignancies may have a immunological assessment before start any kind of systemic treatment in these patients. So we envision that in the future, all the oncologists that daily face with thymic malignancies may assess the immunological profile in these patients before starting any kind of systemic therapy, any kind of immunosuppressive therapy or chemotherapy, immunocheckpoint inhibitor, what else. And this is very important.